On our initial investigation and interaction with the patient, the following was revealed. 2 negative, destructive spirit entities, partial grounding of his spirit with the earth, because we need to be connected with the planet in order to function properly. An interdimensional portal giving access to him from other dimensions. There was a symbolic representation of a restrictive strap across his chest, which restricted it. He had an infection of interdimensional parasites. Now, these are quite common. We're all familiar with how disease is spread in the physical environment, bacteria and pathogens. So we have an immune system that protects us from infection, don't we? Spiritually speaking, you have an aura, which is a shield around your body. And if this aura becomes fragmented or perforated, then other life forms, shall we say, from other dimensions can infect the spirit body. And these are very, very common, so we clear them out, as you would with an antibiotic. He had the voice of one earthbound spirit, of a boy who died at the age of 5. Had a total of 9 dissociated subpersonalities. Now here's a boy who was abandoned at birth, rejected by his primary caregiver, his birth mother. And I have yet to come across such a case, that was not affected by dissociated subpersonalities. Because the personality is split, becomes fragmented. And every challenging situation that the individual is presented with as they grow, if they're unable to deal with that challenging situation, a subpersonality is created of the age that they were when that challenge was not met. So a person can grow physically, chronologically, with all these little subpersonalities tucked away in the unconscious as a subconscious family, and they all squabble with each other and fight, and the eldest ones bully the little ones, and all this is going on. And the psychiatrists go, sorry, don't understand this. Give him an antipsychotic medication, which suppresses everything. And this young man had an aggressive and dismissive attitude, was not able to trust. And when you consider, just for a moment, the inherent trust that a child has with its natural mother, the moment it's born, if that mother gets up and walks away, leaves it, that trust is broken. Which means that that child does not know how to trust. So adoptive parents, psychiatrists, therapists, caregivers, they will all fail because the child cannot trust anyone. Self-loathing. I'm not worth it. I was abandoned. I'm useless. I'm worthless. Anger and hatred at himself, at his birth parents, at the world, at everyone. Resulting in a need for substance abuse and self-medication. So I think you get a picture in case number 2. So let's... Probably not going to have time for case number 3, but let me say what the family has to say. As a family member, it's very difficult to say what, if anything, the effects of telepathic hypnosis are in a case like David's, where one is not seeing dramatic changes. He is certainly easier to be around, has more self-control than a year ago. But it feels quite skin deep, and he hasn't, so far as we know, had any real negative triggers. He gets frustrated with people and situations easily, and his immediate action is to threaten to kill them or have them killed. And he is full of conspiratory theories, coming out with outrageously anti-Semitic hate speech at times. So he still has these influences coming in, strong negative influences. And there's a reason for that. I'll come to that in a minute. I know that the effects of attachment disorder are the kind of reactions he displays: lack of empathy, lack of self-control, needing to be always right, inability to accept personal responsibility, very high levels of anxiety and dependence, masked through aggression and so on. Yeah, this is the important bit. But what struck me about the conversations, because I give her copies of the conversations recorded and the transcripts. What struck me about the conversations recorded with Andrew was that the voice sounded very like David. And it was easy to believe that Andrew was tapping into his personality. If it is possible to get to the root of some of the underlying fear and anxiety, I'll come back to that in a minute, fear and anxiety, and the layers of negative personality traits built up around, that it can only be a good thing for him and for society. Let me go to that fear and anxiety, underlying fear and anxiety. Now, a neurologist will tell you that as far as the brain is concerned, fear and excitement are the same thing. Any of you who've ever done a bungee jump or a parachute jump, when you're standing on the lip and you're ready to go, the fear grips you, doesn't it? But that's excitement. And that's why people adopt these sports, because of the adrenaline addiction. It's exciting. Now, the fear and the anxiety is just a posh word for fear. It's all fear. Okay. So when a person is presented with a frightening situation, they're given the energy to deal with it or run away, fight or flight. It's simple. This is well known to science. Okay. Another interesting thing about this is that fear and distrust are the same thing. So when a person's suffering from attachment disorder, reactive attachment disorder, comes into the presence of someone new, it's a new person to distrust, it's a new person to be afraid of, therapy's never going to work. But what if you can go through the back door, telepathically, to the unconscious and say, what's the matter? Talk to me. It works. So we're now friends in an ongoing dialogue. Case number 3, Derek, another 23-year-old. Section, psychiatric hospital. Now this case, he was diagnosed with autism at the age of 16 and with psychosis at the age of 18. And he'd been talking about being in the dark side and saying that he had a third eye. Of course, his psychiatrists saw this as symptoms of psychosis. So they put him on 3 different drugs. And the mother told me what drugs he was on. So I searched and I printed out the side effects of these 3 different drugs. And collectively, they were killing him. She knew that didn't make sense, but there was nothing she could do about it. So we had to work around that somehow, using the technique. Andrew goes into trance, I ask him to connect with the lad in hospital, and I have a conversation with him. I say, what's up? What's the matter? What's going on? What are you doing? Cleared away the negative entities that had been attracted through his vulnerability. And after the first session, the mother comes back and she says, the day after the session you've done to assist his needs, the changes were visible. He was calm, smiling and kind, his true nature. I was impressed by the identification of the negative entity manifesting in his throat chakra. He had a speech impediment. And this was, his speech impediment's been there the first time since he was 3 years old. And he picked this up in hospital. He had a difficult birth, he was born by forceps. So while he's in hospital, vulnerable, he's attracting negative energies that are feeding on that vulnerability. He's grown up with it. She goes on to say, I was intrigued by the explanation of the fragmentation of his personality. This is exactly how I see his difficulties. He has a pure, kind and crystalline soul. He catches a trapped fly with so much care as to not to hurt the tiny insect. But something then triggers from opposite type of behaviour. He becomes rude, verbally aggressive, pretending to be a gangster and wants to kill everybody. Dual personality, dissociative identity disorder, spirit possession. We can't speculate on what caused this, we have to investigate, we have to ask. She goes on to say, our experience with the health professionals has not been easy, and I'm alarmed at the inhuman way the mental health patients are treated. They treat the condition and not the person, and the treatment is exclusively focused on chemical medication. I still feel that Derek needs the right medication, but I agree that the way the psychiatrists administer the medication can do more harm than good, and I am now fighting to get him back home. And we did get him released from hospital because his behaviour improved and they had no reason to keep him. Derek's now been home for a month and he's doing well. He's been sleeping a lot and he hasn't presented any signs of distress. He still talks about aliens from time to time, but it's not in the stressful and manic way that it was before, so he's doing quite well. She goes on to say, a couple of months after that, Derek's doing really well. He now takes part in daily activities without any prompts and his communication is improving. Compared to the state he was in last year, it's so encouraging to see him healthy again. I will always be grateful for yours and Andrew's work. And thank you so much for sharing the videos. Now, rather than explain to the family what's happening, I record everything and send them a copy so they can listen to it themselves. She goes on to say, well done, it's well needed to educate the mental health professionals so they can offer a more humanising approach within their services. So this is the first level in the scientific validation and efficacy of these methods. The reports we get back from the family, does it make a difference? And I'm grateful at being presented with with cases that are so challenging to mainstream psychiatry and therapy. Because in a very, very short space of time, we've seen dramatic changes in all these three cases. And these are the most difficult ones to treat. The easy ones I dealt with, I had one this afternoon. Well, I was getting dressed to come here this afternoon. I got a call from a woman that said, I'm hearing voices, can you help me? I said, okay. We sat down, Skype, one-to-one. And I said, can I talk to your voices? She said, yeah, I'm happy to, but they probably won't be happy. I said, why did you say that? She said, it's gone very quiet. I said, are they still there? She said, yeah, but they've gone quiet. I said, well, I'm going to talk to them. And she spontaneously, I don't have to induce an altered state of consciousness. I don't have to use a formal hypnotic method. I just said to her, okay, just allow her to speak through you. The loudest, noisiest, most troublesome voice. She'd been persecuted by a family of voices for years because they had a vendetta against her. I said, let me talk to the noisiest one. What's your name? A name comes out. Okay, what are you doing? She deserves it. Deserves what? So I had a brief conversation with her, went through the process of calling her grandfather from the line, escorting her to where she's supposed to be, and it was done in 5 minutes. Case solved. But these cases, this goes back to something that William James said. It's the most difficult, the most challenging situations that give us the opportunity to explore the depth of human consciousness. So I'm going to end there and ask you if you have any questions.